Well, good morning, everybody. We're going to give everybody just a few more seconds to filter in, and then we'll get started. All right, hello and welcome to our July webinar, All Ages, All Stages NC. We're going to go over just a couple of our Zoom features real quick so that you guys know kind of how Zoom works in the webinar mode. Rebecca, if you want to go to the next slide. Oh, there it is. All right, so we are in Zoom webinar mode today, so you're automatically muted. You can't see any of the other participants, but you can see speakers and hosts. So if you have any questions, just go ahead and throw those in the chat box. I know that Divya and Rebecca can address questions at the end of the webinar today. As you can tell, we are being recorded and we post all of our recorded webinars on our website. If you want to watch afterwards or if you want to share with anybody, you will get a certificate of attendance. So be on the lookout for that after the webinar is over today. And I'm going to turn it over to Kristen to introduce our speakers.
Good morning, everyone. So we have two speakers today for the webinar. We have Divya and Rebecca. Rebecca Freeman serves as a Section Chief of Service Operations for the NCDHHS Division of Aging, which is responsible for the overall development and implementation of policies and procedures related to operating home and community programs such as senior centers, family caregiver support, dementia and Alzheimer's initiatives, respite, transportation, and nutrition. Rebecca earned a Bachelor's of Arts in Psychology from East Carolina University and a Master of Public Health with a concentration in health policy and management from the University of North Carolina at Chapel Hill. She is passionate about helping older adults remain filled with a sense of purpose. And Divya Venkatanason is a Section Chief of Planning for the NCDHHS Division of Aging. She supports managing applications such as ARMS and providing IT system support. She also works with the State Aging Plan and Multisector Plan for Aging, supporting data requests, releasing annual state county aging profiles and demographic slides, and conducting monitoring and audit. She holds a BA in Biology and Medical Anthropology from UNC Chapel Hill and an MPH from UNC Gillings School of Global Public Health. Her early roles as a Senior Center Program Coordinator at Resources for Seniors and Healthy Aging NC Falls Prevention Project Specialist at the NC Center for Health and Wellness provided local perspectives before joining the NC State Unit on Aging. Divya is dedicated to fostering cross-sector collaboration to build a robust infrastructure for addressing the evolving needs of the aging population.
Good morning. Thank you all so much for joining us today. Rebecca and I are thrilled to present about NC's multi-sector plan for aging, all ages, all stages NC. Today, we'll take you through our incredible journey we've been on since 2022 to create a plan that we believe will powerfully support our growing aging population for the next decade to come. As we gear up for the plan's release in September, we are immensely grateful for everyone who has contributed to this initiative. This whole of government cross-sector effort has truly united all of us in proactively and collectively supporting our aging population. Our vision is for everyone, regardless of age or stage in life, to become invested in making this vision a reality. So throughout this presentation, we invite each of you to actively participate and engage in this work. We'll start off with some data first. So you all may have seen some of this data before, but I wanted to highlight a few key numbers to set the stage. North Carolina ranks 9th in total population and also 9th in population 65 and over. Our state is home to an estimated 11 million people, and looking ahead to 2042, the number of individuals 65 and over is projected to increase from currently 1.9 million to 2.8 million, which is a 48% increase. So here is another way of looking at this data. 1 in 6 were 65 plus in 2022. And current projections indicate that by next year, that 1 in 6 will become 1 in 5 individuals 65 and over. This is particularly noteworthy because in last year's presentations, we were saying that it would be by 2028, where we'll have 1 in 5 people 65 plus. We're actually 3 years ahead, and this just underscores the rapid aging of our population. The next slide is a way of looking at this through our age cohorts. The growth of the 85 plus population is significant, with projected growth at 114%, notably driven by the generations born between 1946 and 1964. As they age, we anticipate a higher proportion of the oldest old in the state, leading to an increased demand for long-term services and supports. I want to spotlight one last but very important data to share how crucial it is to recognize the scale of caregiver responsibilities and the immense value of unpaid care provided by caregivers in North Carolina. Many of you are probably caregivers yourselves or know someone who is a caregiver. With 1.3 million caregivers dedicating their time and effort, it adds up to a total of 1.2 billion hours of unpaid care that is given. And if they were to get paid for this work, it translates to an estimated total value of $16.5 billion worth of caregiving support just in North Carolina. Understanding these figures is really important for appreciating the significant contributions of caregivers to our communities, and also for advocating for the support and resources that they need to continue their vital role in providing care. So I'll turn it over to Rebecca.
Thanks, Divya. The Division of Aging has been focused on this anticipated growth for a few decades. I remember when I first came to the division in 2014, hearing that by 2020, there would be more older adults than young people in North Carolina. The vast majority of counties are already there. So to help y'all understand our multi-sector plan for aging, we thought it would be helpful to understand kind of the background that happened to get to where we are now. So back in 2021 or 2022, excuse me, a few groups came to the table. One was AARP of North Carolina, focusing on their age-friendly effort, and they were partnering with Hometown Strong, which is an initiative out of the governor's office to address rural needs of North Carolinians. So those two entities were thinking about how to make North Carolina an age-friendly state. And they naturally reached out to the Division of Aging, and the three of us began collaborating to start making the case to the governor that we needed action. So you may have been around, you may have heard the term Age My Way. That was the Older Americans Month theme a couple of years back, and we leveraged that theme to start getting input about aging in North Carolina through an Age My Way survey, through Age My Way listening sessions, and then finally through a summit, which I'll talk more about in a little bit. Simultaneously, at the Division of Aging, we had received notice of an opportunity to participate in a learning collaborative to learn about developing a multi-sector plan for aging, or at that time it was called a master plan on aging. We didn't really have much understanding of what a multi-sector plan for aging was, but it sounded really important. And so we decided we didn't really have a lot of risk to apply for it, so we did, and just to learn what this was all about. And we were one of the 10 states, you can see the others here, that were selected to participate in this multi-sector plan for aging learning collaborative. And just so you understand a little bit of what that is, it was really just where different states come together to learn from each other, and also from experts who had already gone down this path. And so California was really leading the way, and then there were some other entities like the Center for Healthcare Strategies and West Health, who were national organizations that helped guide this work. So we went through a year-long process to learn what it takes to develop a multi-sector plan for aging. It turned out to be really important that this was going on at the same time as the other groups were working on looking at North Carolina being an age-friendly state, because part of being an age-friendly entity involves a planning effort. And so the two initiatives kind of merged into one, which took us on a very important timeline. So as I mentioned, one of the first big things that we did was October 5th of 2022, we hosted a big summit called the Age My Way Summit. At the summit, we featured Governor Cooper and stakeholders from across the state. We learned about the results of the Age My Way survey and listening sessions, what kind of things had really risen to the top, and started to really put a bug in people's ear that we were going to do something big in North Carolina. Right after that summit, we started working on our application to become an age-friendly state. So I don't know if any of the people on this webinar have done that before, but that's a process to join the network of global age-friendly communities. You have to apply for that. And so that took a lot of thought and leadership. And then very shortly after that, we also pursued an executive order from the governor's office calling for North Carolina to develop a multi-sector plan for aging. One of the really important things that makes a multi-sector plan on aging unique is that it's unlike the state plan on aging, which is really just our state aging networks initiative. A multi-sector plan for aging is a whole of government approach that needs involvement from various cabinet agencies such as transportation, housing, commerce, etc. And so you really need to have either legislation or a governor executive order to legitimize the effort and get everybody moving in the same direction. So we began pursuing that in January of 2023. In February, shortly thereafter, we formed a governance structure, a steering committee, and what everybody's roles were, what everybody's expectations were, and then set a meeting cadence of how often we would get together. In March and April of 2023, we identified 4 focus areas that we wanted to use to shape our work. And then we were really fortunate on May 2nd of 2023, we were invited to the governor's mansion where he signed Executive Order 280, calling for North Carolina's commitment to building an age-friendly state. So North Carolina at this day was also accepted into the Global Age-Friendly Network, making North Carolina the 10th state in the nation to demonstrate a commitment to building an age-friendly state. But as I mentioned, it's not enough to be age-friendly alone. You have to have a plan. And so the executive order spelled out that the Department of Health and Human Services would implement a planning process with working groups to develop a multi-sector plan for aging. It called for it to be led by the Division of Aging, along with the Division of Health Benefits, which is our North Carolina Medicaid office. And it did say that a report would be submitted to the governor a year from the date of the executive order. I should also mention that the executive order called for all cabinet agencies to cooperate with this initiative. So it was off to the races. We got to give a presentation in California, and it was called Hitting the Ground Running, which is a very accurate description because we knew we needed to work quickly while Governor Cooper was still in office, and also because we were expected to give a progress report 1 year from the date. And so we quickly came together and came up with the name of our initiative. As you see, All Ages, All Stages, North Carolina. That is the name of our multi-sector plan for aging. And we have a tagline that explains a little bit more about what it is, a roadmap for aging and living well. And then you can see here that the 4 focus areas that I mentioned before are listed, and we'll talk a little bit more about those in a few slides. So a few more things that happened last year. We hosted a second meeting. This was our June 5th kickoff. And this was really the first time that people were called to action. So this is where we asked people to let us know if they would like to become a member of our steering committee or be a stakeholder. We could not accept everybody that wanted to be a steering committee member because we, of course, needed to keep the steering committee a size that was manageable. We had over 85 applicants, and I think we accepted about 7 additional people to really broaden the expertise that was represented on the steering committee outside of the aging network and bring in some non-traditional partners. But we did let everybody who wanted to be a stakeholder to join a group, and so they were told the 4 different focus areas and were able to select which group they wanted to be a part of. We spent the summer, first choosing those steering committee members, and then secondly, helping prepare secondly, finding people to lead the various focus groups, the subgroups, and then also making sure that those people who are leaders had the information that they needed to be able to lead their groups effectively. And then in September, just a few short months afterward, was the first time that we pulled everybody back together. And this was really the first time that those work groups, those individual 4 work groups, met and started working independently. And from September to February, those work groups had a very, very big task. And that was to learn about what existing initiatives are out there, because we didn't want to reinvent the wheel. To hear from presenters, hear from subject matter experts about different needs or different issues. And then 3, and most importantly, develop objectives and recommendations to help inform the plan. Simultaneously, from September to November, we conducted some targeted focus groups, because the listening sessions and the surveys that we had done, while they were quite robust, and represented a lot of North Carolinians, we knew we had not heard from our historically marginalized populations in North Carolina. So we conducted several different focus groups to hear from voices who may not have been represented before. So by the end of February, we were really thrilled when all of our work groups actually came back with recommendations and objectives. They met that timeline, which I have to say was no easy feat, because it took a little bit of time for them to even get their bearings and then come up with times that worked with all of their individual work groups. Most of them broke into subgroups, and then organizing those. And then you have Thanksgiving and the holiday season in December. So it was really a challenge for those groups, but they did it. They came up with their recommendations by the end of by the end of February. And then in March, we brought all of those work groups back together for our our 4th convening. And at this time, we actually published all of the different raw recommendations. We didn't edit them hardly at all, unless there was a typo, and put them on poster boards. And this was really the first opportunity for public input into the recommendations. We also put the recommendations on our website and presented at a couple of conferences and sought public input for the following few weeks. And then at the end of March, that public input period closed. We shared that public input with our steering committee, with the work group leads, and then also we gave different cabinet agencies the opportunity to provide input as well, hear the input of others, and help us refine our recommendations even further. So we were really thrilled on May 2nd, a year from the date of the executive order, to submit the progress report to Governor Cooper. You can see a screenshot of it here. And as Divya mentioned when she spoke earlier, we plan to publish the All Ages, All Stages North Carolina plan in September of this year. So please be on the lookout for that. So just a few things for you to understand about what the work groups worked on. So as I mentioned, there were 4 different work groups. The first one was focused on affording aging. And this is basically saying, kind of what it sounds like, that will afford to age, that you'll have the means to plan for your later stages of life, including sufficient and sustainable financial provisions, and having avenues for personal growth and the betterment of your communities. So some of the different things that the work groups talked about, one, educational opportunities for older adults. We know as people are living longer, which is a wonderful thing, people want to continue to learn. And so how do we make that possible as a state? What kind of things can we do? Also, knowing that as more people are living longer, we also need to be sure that our programs and supports that help older adults stay in their home and community are well funded. And so can we as a state afford aging? Advocating for age-inclusive workplace practices. People sometimes want to work longer. There's a lot of age discrimination out there. So what can we do to address that? Intergenerational efforts. Older adults and young people have a lot to learn from one another when they come together. And then finally, financial literacy and retirement planning. What can we do to make sure that people have the money in their pocket to retire comfortably? The second goal, optimizing health and well-being. So this is about having person-centered services and supports that optimize life expectancy and health quality. So this is really our healthcare, our wellness and prevention space. So things like innovative healthcare delivery, accessibility, having a culture of healthy aging. So thinking about what we can do so that people can remain healthy as they age, and kind of going along with that, having a continuum of care services. So things that help people stay healthy from well all the way to taking care of folks as they become frail. long-term care financing and delivery options, and then the big healthcare workforce is one of the things they talked about. The third goal is strengthening communities for a lifetime. So this is stating that North Carolinians will live in communities, neighborhoods, and homes that support thriving at all ages and all stages. So this is really the infrastructure level, or what we think of when we hear, more about the age-friendly work that's being done all across the nation, looking at things like disaster preparedness, emergency management, transportation, housing, food, and then also looking at ways to keep people connected socially, because we know that social engagement and social connectedness is a really important social determinant of health. And closely related to that is digital literacy, because more and more people are connecting through things like Zoom, as we are today. And then the fourth goal is supporting older adults and their families. So this goal states that North Carolinians will have access to services and resources that enable them to stay in their homes and communities as they age, and will support their families in their efforts to provide care when needed. So this is the one that's really looking at the caregivers as well. So we think of a lot of the work that Centralina and the different local providers in that region and all across the state, that's where we see our work. It's the traditional aging and caregiving services, but also really important to bring in the disability community. So this group of individuals looked at multidisciplinary teams for dementia care, all the different solutions that are offered by technology these days, such as artificial intelligence, cloud services, etc., caregiver support, aging individuals with disabilities, and then also long-term services and supports was one of the things that these folks talked about. So now I'm going to turn it back over to Divya to talk about what is being shaken out in the final plan.
So you all are actually the first to hear about these priorities, but during May and June, we've concentrated on prioritizing the over 160 recommendations from the stakeholder work groups. Many of you participated in these work groups or presented as subject matter experts. So these recommendations have been synthesized into 8 key priority areas and 43 actionable steps, really shaping the way for the next 2 years as our priorities. Each of these priorities have actionable steps that will guide effective implementation. Each of these priorities also address long-standing challenges that have persisted over the years, reflecting issues where gaps in services, support systems, and community environments for older adults are more pronounced. These priorities encompass our 4 overarching goals that you heard about and the 20 subgroup priorities, as well as the national strategic frameworks, domains, and priorities that Rebecca will talk about at the end of the presentation. Input from our steering committee and work group leads have been instrumental in ranking these priorities and the actionable steps. And by organizing the recommendations into these key priorities, we feel that we can communicate the plan more clearly and manage its implementation efficiently. So at a high level, I'm going to talk through these key priorities over the next few slides. First, I'm starting with priority 1, which is home and community-based services. HCBS encompasses, as you all know, a broad range of health and human services provided to individuals in home or community settings, as opposed to facility-based settings such as assisted living or nursing homes. So for the HCBS priority, 3 actionable steps have risen to prominence and importance. First, we aim to secure funding to replace the Division of Aging's 30-year-old Aging Resource Management System, ARMS. This upgrade is going to be really important for timely provider payments, enhanced data collection and reporting, as well as improved program management and oversight. Second, we plan to review the current operation and structure of the Home and Community Care Block Grant, making any adjustments to ensure its ongoing effectiveness and efficiency. Third, we aim to explore new funding options such as Medicaid, the private market, and cost sharing. And by incorporating these new resources into the existing funding streams, such as the block grant, we feel that we can address the growing demand for services, managing the wait list a little bit better, particularly in the wake of COVID-19 funding cessation. There's also work that is being done to comply with the final rule with the updates and regulations for implementing the OAA programs to better support the aging network that delivers Older American Act services and improve program implementation. So at a high level, this really showcases what we plan to do to maintain the quality and accessibility of home and community-based services for older adults. Next is housing. So housing is a fundamental component of ensuring the well-being and quality of life for older adults in North Carolina, but it presents both challenges and opportunities as the population ages. We've heard over and over again with the growing preference that older adults want to age in place, remaining in familiar communities and homes, but there is an increased need for safe, affordable, and accessible housing options that cater to their specific needs and preferences. There's a lot of barriers with limited affordable housing stock, inadequate accessibility features in existing homes, and a lack of supportive services that often hinder older adults' ability to remain independent and engage in their communities effectively. So for the housing priorities, several actionable steps have emerged. I'm just going to highlight a few of them. First, we would like to advocate for executive action to address housing challenges. We also want to work to increase incentives such as tax credit or no or low interest loans for developing additional housing stock. We also want to ensure that we are encouraging the adoption of universal design principles in housing development and renovation, as well as ensure that the evolving housing and support needs of aging individuals with developmental disabilities, traumatic brain injury, and/or mental health, their needs are met so that they can continue to age in place and have equal access to supports, programs, and facilities. The next one is the caregiving support priority area, and I shared about the NC caregiving data earlier, but North Carolina faces significant demographic challenges with its aging population as more individuals reach retirement age and prefer to age in place. And this preference places a substantial responsibility on family members who often have to step into caregiving roles, managing their daily activities, but also other activities, healthcare needs, and advocating for their loved ones' well-being. So for the family caregiving support priority, 5 actionable steps have emerged. First, we have highlighted the importance of blending and braiding federal, state, and local funding for services such as home and community-based services, including Project Care. We also aim to enhance family leave requirements, including paid and unpaid family leave, and support employers who adopt family-friendly workplace policies. This one is a long-term goal of ours, but we have to initiate action now to be able to get towards enhancing family leave requirements. Additionally, we'll explore the possibility of a state tax credit for family caregivers to help cover out-of-pocket costs, as well as secure funding for the North Carolina Caregiving Portal, which is a free online educational resources. And last but not least, we aim to establish a streamlined referral process to ensure that caregivers receive information available about training and resources and linking it to NC 211 and NC Care 360. The next priority is workforce. As more individuals enter their later years, the demand for specialized care and support services rises exponentially, and this challenge is compounded by factors such as workforce shortages, retention issues, and the need for enhanced training and diverse skill sets to address the complex health and social needs of older adults. Addressing these challenges proactively is going to be essential to ensure that older adults receive the high-quality care and supports necessary for maintaining their health, independence, and quality of life. So for the workforce priority, 4 actionable steps have emerged that we would like to prioritize as essential needs. We aim to identify and implement steps to ensure that there is a knowledgeable and skilled workforce for the increasing diversity of roles in the aging field, particularly given the impending retirement of many long-term workers in this sector. We also want to recognize the importance of supporting the NC Center for Workforce for Health as they tackle recommendations from the NC Caregiving Workforce Report and other studies, including the Medicaid rate and wage analysis to guide rate setting for long-term services and supports. And there are also several other actionable steps that we aim to prioritize that are linked on this slide. So for the next priority is LTSS, and LTSS plays a crucial role in enabling older adults and individuals with disabilities to age in place, supporting community integration and preventing unnecessary institutionalization. By investing in robust long-term services and supports infrastructure, we know that we can enhance care coordination, improve health outcomes, and again, promote independence and dignity for those receiving care and their families. So for this priority area, 3 have emerged as ones that we would like to prioritize. And I want to note that long-term service and support is actually one of the 4 national domains that you will hear about later on. So what we want to do is we aim to convene a task force or legislative committee to initiate planning for delivering and financing services and supports for a growing number of individuals, including the middle-class individuals who sometimes lack financial resources for extended care. Additionally, we seek to enhance awareness and understanding of long-term care costs and Medicare limitation through SHIP's Medicare 101 sessions, as well as identifying and addressing policy, procedural, funding, and other barriers hindering the development of comprehensive continuum of care services and supports. Next is the Adult Protective Services priority. And really, we want to elevate the great work that the state is already doing with the APS Improvement Plan. They have 3 dedicated design teams under the DSS's Adult Services section, driving this work forward to propel work to really support and safeguard vulnerable adults who face risks such as abuse, neglect, and exploitation. So for effective implementation, we want to align with their work and collaborate closely and provide support to enhance these initiatives. So some of the areas that they would be focusing on for the years to come are advocating for statutory changes, as well as allocating state funding to county DSS for APS, including emergency service provisions. And then another one is to create a pilot alternative response program for county departments of social services aimed at improving protective response times and enhancing essential services. We've got 2 more priority areas. I'm going to breeze right through those. So the next one is potential of older adults. And this is really about comprehensive approach in addressing the critical aspects such as retirement planning and savings, financial literacy, intergenerational engagement, proactive planning, ageism, and lifelong learning. So really everything that our Affording Aging work group had focused on, we've really been able to synthesize this into this priority area. So Rebecca covered those earlier, and so all of them really fall into here, but I just want to do a special call out to a few of them. So one we'd like to do is promote retirement saving among state residents by advocating for legislation to establish a state-facilitated program similar to the Work and Save model, enabling businesses to offer retirement saving plans through payroll deduction. We also intend to try to address healthcare affordability by revising eligibility requirements for Medicare saving programs, as well as looking to reestablish the Prepare Pre-Retirement Planning Program for state employees and encourage private sector employees to offer similar programs in their workforce. Last but not least is our age-friendly state and community priority. And we joined the age-friendly network as a 10th state. So we want to continue to assist communities, businesses, healthcare facilities, educational institutes, and others in pursuing age-friendly designations at the regional and local levels as well. We want to continue to promote a culture of healthy living, as Rebecca stated in one of the other work group goals, to increase awareness of great programs such as falls prevention, the NC Senior Games. All of these programs do a great job at enhancing the health and well-being of older adults. We also want to strengthen collaboration among private, public, and nonprofit agencies to combat social isolation. There are so many other actionable steps under here, so definitely do take a look at this when we release the plan in September related to transportation, nutrition, and I want to call out also that we propose to reestablish a legislative study commission on aging to thoroughly examine aging issues and make annual recommendations to the NC General Assembly. So these initiatives, all of these that I've shared today, we've again consolidated the 160 recommendations into these targeted priorities and actionable steps to guide our actions effectively over the next few years. Advocating and working together is going to be crucial because achieving our goals really depends on all of the collaborative partnerships. And by uniting our efforts, we know that we can turn these priorities into tangible outcomes that will significantly benefit our communities for the years to come. So I'm going to turn it back over to Rebecca.
Thanks, Divya. So that's where you all come in. It's really important that we have everybody coming to the table to get around this initiative, to raise awareness and to advocate. So we know that we already have a coalition of stakeholders from all the people who participated across the state, over 275 people, to help develop the initial recommendations. And all of those groups of people have lots of connections. So they're going to be an army of people that can help advocate for this. We also in North Carolina are fortunate to have several really great advocacy groups like the North Carolina Coalition on Aging, the North Carolina Senior Tar Heel Legislature, the Governor's Advisory Council on Aging, just to name a few, who have really shown a lot of support for this initiative. We are hoping and excited that our area agencies on aging and councils of government are going to continue to support this initiative. We have representatives on the steering committee from AAAs and also many representatives from AAAs in the different work groups. And then finally, and most importantly, I believe, is getting the involvement at the grassroots level, people who come to senior centers, people just living in their community who are aging, which is every one of us. Having all of these people coming together is very important to make sure that the powers that be know that this is an initiative that is really important to many. And so we do have a public relations and advocacy plan in place. We have contracted with a public relations firm to do some media, paid media through different venues such as Our State Magazine, PBS, and others to help to reach people who we may not be able to reach otherwise. So we did a first phase of that media campaign back in April, and at that time we estimated that we had 2.4 million impressions. Some of you may be aware that in May there was an Aging Advocacy and Celebration Day, and at this time folks were at the General Assembly were made aware of this initiative and given some fact sheets about it. We also had a second phase of our media campaign, and this is really where we started looking at more television space, but also continued much of what we were already doing. And we estimate that we'll reach 42 million impressions during that time frame. So if you see an ad for I'm Still Here that links you back to our All Ages, All Stages, that's part of that initiative. From July to September, Divya has been working with the UNC Shep Center to create a data dashboard, because we know that what you're trying to work on needs to be measurable, and it needs to be something that other people can see progress on. So the data dashboard will look at the progress of the All Ages, All Stages plan, and then also provide a one-stop shop for all kinds of aging data for all of our partners to use in their local advocacy. From September to October, senior center folks and also different agencies are having the opportunity to host candidate forums. I know that the North Carolina Association on Aging just sent out a toolkit to how to conduct these candidate forums with questions already rewritten or pre-written for candidates to be asked about aging and what folks are going to do to help respond to aging in North Carolina. And then finally, September 27th, you are also among the first to know we do plan to have a celebratory event on that day when the plan is finally published. It's really important for everybody to understand that this isn't something that North Carolina decided to do in a vacuum. It was actually part of a national movement where North Carolina has had a really amazing opportunity to show leadership as being one of the first states to participate in the Learning Collaborative and the 10th state to join the Age-Friendly network. So thanks to partnerships, the support of the governor's office, we are among a select group of states that's been at the forefront of the movement. So this statement just comes, if you Google Multi-Sector Plan for Aging, there's a webpage dedicated to that at the national level, and it basically says that all states need to be doing this work to make sure that older adults can age with health, dignity, and connection. I don't have a slide dedicated to this, but I did want to mention that there has been, I'll come to it, never mind. I'm getting ahead of myself. 2 slides from now, I will talk to you about our national strategic framework. But before I do that, I did want to point out where other states are in the process. So you can see here that the light blue states are kind of where we were when we held our Age My Way Summit. We're doing listening sessions, just really trying to make the case. The states that are dark blue, so you see North Carolina, I believe that might be Arkansas, but I'm not 100% sure, New York, those are states that have existing legislation and are actively working on developing the plan. And then the states that are in orange, like California and Texas, are states where there already is a fully developed multi-sector plan for aging, and now they're in the implementation stage. So back to the National Strategic Plan for Aging. So in February of this year, National Senator Gillibrand and from New York and Senator Casey introduced the Strategic Plan for Aging Act. And this bill would create a national new grant program under the Older Americans Act to incentivize and support state efforts to create strategic plans for aging or multi-sector plans for aging. It would award grants to states, territories, and tribes to create or continue developing their multi-sector plan. The plan would cover a 10-year period, which our plan also aims to do. The plan would direct state, local, nonprofit, et cetera, to collaborate on solutions that touch on all areas of life, like we are trying to do in North Carolina. So while we know that this may not actually pass, it was just a bill that was introduced, it's really an important step in guaranteeing that the entire nation is prepared to care for its growing aging population. And through these efforts, states will be supported and incentivized to create plans that ultimately guide policy choices and investments at the state level to ensure that aging populations can live with dignity. And so, as I was mentioning, I don't have a slide on this, but at the national level, they have published their national strategy on aging. And it really, as we saw it, it really validated what we're doing in North Carolina, because their 4 focus areas or domains are very aligned with what we're doing in North Carolina. So their first focus area is age-friendly communities, looking at things like purpose and engagement, social connection, accessibility, universal design, transportation, financial security, employment. So very much in line with what we are looking at. Their second domain, coordinated housing and supportive services. And then their third, increased access, as Divya said, to long-term services and supports. And then fourth, align healthcare and supportive services. So we, again, know that we are on the right track in North Carolina as we align very much with what the national strategy is focused on. So one of the things we like to ask people as we close is, why is this important to you? What do you need to know? Well, one, knowing that the state is doing this, and hopefully getting you all to get behind it is really important to us. But then also kind of thinking about your own agency, and are you ready? You know, asking yourself, are you ready to meet the growing demand of older adults? And is there data and information that you need to help plan? That's something that we at the state can help with. Centralina can also help you with that. Have you considered policy and program changes that will be needed to ensure that you are meeting the needs of an aging population? And then also, what is your own workforce going to look like? Do you have the people? Do you expect to have the people that you need to be able to meet the demands of an aging population? So there's several different ways that you can get involved. Hopefully these slides will be shared, and this is a clickable link. So this is a place where you can answer 4 short questions to share your thoughts about aging in North Carolina. And importantly, once you do that, that will automatically give you the opportunity to sign up for the All Ages, All Stages North Carolina newsletter. We aren't sending out too much. It won't clutter up your inbox, maybe 2 messages per month, but it'll really keep you abreast of the progress of it. And what we really hope that you'll do is, when you sign up for that newsletter and you get that information, you will share it with your partners to help spread the word. And then finally, making sure that all of you are talking to your representatives, either through those candidate forums that that can be offered this fall, or just directly to talk to them about All Ages, All Stages North Carolina, and make sure that they can get behind this work, particularly with this being an election year. So these are just some links that we wanted to make sure you have so that you are knowledgeable about aging in North Carolina. Each of these links takes you to a very brief blog article that can share more about aging and some important demographics. And then finally, we have this set of links where you can get linked to our progress report, our All Ages, All Stages website, which was also linked on a previous slide. Joyce Massey Smith is our director at the Division of Aging. She is chairing this initiative along with Mary Bethel. I don't have on here, but Jill Simmerman has recently joined our team as deputy director, and she is also at the leadership table with this. And then my contact and Divya's as well, if you have questions after this presentation specifically. And I think that's the end. So I don't know if there's any questions, Kristen and Caitlin, but we're happy to stick around.
I haven't seen a ton come in. I think Divya, you were answering a couple that came in during the presentation, but if anybody has any other questions, this is a great time to throw them in the chat. You guys must have just covered it perfectly. Everybody's thanking you for the information. Lots of thank yous. Thanks for the links.
Everybody is very welcome. We're always happy to share this information. And if there's any other groups that you feel like need to hear this information, we are always looking for opportunities where we can present and share to other audiences. Oh boy, that's the first time I've seen that. I see the ad for this every morning on PBS. That's super exciting. Thank you for sharing that. SUD. Substance use disorder, is that what SUD is?
Yes,
Okay.
yeah, I was wondering too.
So within our Department of Health and Human Services, there is a division of mental health, developmental disabilities, and substance use disorders. And I can try to find that real quick on a link to their website on my computer real quick and drop that in here. I will share that we have been actively engaged in conversation with that division to talk about how we can better collaborate to address behavioral health among older adults. So stay tuned. We haven't really gone anywhere further than having discussions and participating in we had a technical support from the national partners about this issue, but we are still considering what activities will happen as a group. But let me try to get that link and put it in the chat. There. Hi, Alice. I see Alice Keene's name all the way from Pitt County, North Carolina.
Just realized I was muted. Divya, I think you wanted to see if we could play a video if we have a little time. If you want to try that, we can.
People who haven't seen it on PBS, I think if y'all want to see the campaign, we could definitely get it up on here. And I saw a quick question about, can we do this presentation at the senior center level to promote the plan? Yes, absolutely. And I think Rebecca also spoke about the senior center candidate forums. I think it's a great way to link the messaging about all ages, all stages, and also about other messaging. So.
Yeah, and we did present about this at the Ann Johnson Institute, but we could definitely do a webinar through the Senior Center listserv and reach all the different senior centers in North Carolina.
Let's see here. Guys, bear with me. I'm rusty on sharing videos, and sometimes the sound does not always cooperate. See. Let's see if the sound works. Can you hear it? Okay.
Is a dream come true.
Are you serious?
With elevated living and relaxation. And outside your door, endless possibilities await.
Okay, enough. There are more.
I'm still here.
And stop calling us baby boomers. We haven't been babies in a long time.
Did it play all the way through?
Retirement bliss, where each day.
It cut a little bit out, but we can get the link to you all on LinkedIn. So if you haven't seen it on PBS, you have an opportunity to see it on LinkedIn. And I saw another question in the chat about what is DHHS doing to leverage technology to combat social isolation? Rebecca's been working in this space and she could definitely share about Social Bridging NC and the virtual connectivity program. So I'll turn it over to her to say a little bit.
So social isolation is one of the things that we've been focused on for a long time at the division, and our senior centers in North Carolina do a really, really great job of addressing social isolation. But as you all know, during the pandemic, with all the senior centers and congregate sites shutting down, it was a big problem. And so we formed a little work group that was kind of internal at first, and then we had other partners come to the table to look at social isolation. We did several different things, but specifically to technology, we did lean into a lot of virtual programming through our Social Bridging NC site, which I'm happy to put into the chat. I encourage you all to explore it. This is a place where you can find all kinds of online resources to address social isolation. But importantly, senior centers have stepped up to the table offering virtual programs through Zoom, etc. And so this is a place where you can access those programs from anywhere in the state. We're really excited about that and trying to get more senior centers on board with publishing the programs that they're already providing virtually on this site. It's real easy for them to do that. So if you are a senior center person, please get your information to us and we'd love to help market it. But one of the things that came up was that, and we knew this, that not everybody has broadband, not everybody has digital devices, and importantly, not everybody has the skills needed to access these devices. And so we did apply for some of the funding that came to North Carolina through ARPA to address digital equity. And we received a $1.12 million grant. And in that grant, with previous money, we had developed kind of a curriculum for digital navigators, and we are going to be, and toolkit, we're going to be hiring digital navigators starting in August throughout the state. So Central Carolina region will have a digital navigator. Some AAAs had to pair up because we didn't have enough funding for every single AAA to have a digital navigator, but we will have those 11 digital navigators to serve the state for a 1-year period. So we're really excited about that. And our advocates are looking at advocating for ways to sustain that. We know it'll make a big difference. And transportation is a huge initiative and definitely a priority. We hear that a lot. So thank you for sharing that, Judy. I believe that the plan will highlight some of the things that the Department of Transportation is working on to address transportation specifically to older adults. It is on their radar, and we're looking forward to hearing how they are planning to make sure that those needs continue to be met.
Right, I think you guys covered everything.
I did see somebody ask how many people were on the, oh, I see 120. Never, okay.
125.
Woo-hoo.
All right. Well, thank you guys. Thank you, Rebecca. Thank you, Divya. And thank you for everybody for being with us today. I've seen lots of comments about getting the presentation. Yes, we will send out a copy of that. And if you have any specific questions, I think Divya or Rebecca will be happy to hear from you. So thank you, and we'll see you next time.
Thanks, everyone. Take
Bye.
care.